External cervical resorption, a volumetric analysis on evolution of defects over time. An article published in JOE 2023 by Ali Nosrat from University of Maryland, along with his colleagues from different US-based schools. The still open for interpretation anterior etiology of external cervical resorption and its progression rate place clinicians in a challenging decision-making spot. Furthermore, being mostly asymptomatic, patients can be hesitant to accept treatment, whereas clinicians have no evidence-based answer to consequences of no treatment. The aim of the study was to determine and analyze external cervical resorption defects over time. For materials and methods, endodontic clinicians in the United States were contacted to submit baseline and recall CBCT records that meet the criteria of their patients diagnosed with external cervical resorption who opted to have no treatment. Following that, each patient set of DICOM data were aligned on a data viewer before exported to CT Analyzer software to quantify resorption defects in cubic millimeter and ratio of resorption. Also, 3D classification of Battelle was assigned to teeth at baseline and recall CBCTs. For the results, after reviewing CBCTs of 15 patients with 20 teeth, mostly anteriors, at baseline and recall, period of 8 to 60 months, the authors found all teeth showed an increase in the volume of external cervical resorption defects, as well as an increase in the volumetric ratio of defects. 2. All teeth showed a change in classification at recall. 3. Significantly more teeth had root perforations at recall CBCTs. And in figure 2, these are still images of a case segmented from the patient's CBCT. A, the labial surface of an affected tooth at baseline with the defect in green, while C is the overlapped STL at 1 year recall, with red highlighting the resorption defect extensions. In conclusion, the volume of external cervical resorption defects and the number of root surfaces perforation usually increase over time, which might negatively impact the prognosis of the tooth.